Hey, it's Cathy. So with the coronavirus pandemic going on right now, I know there are a lot of stressed out nursing students as well as nurses out there. For students, in all likelihood, you've had your clinics canceled. You're either taking classes online at home or you've had your classes canceled. And I know that proctored exams and Nclex exams have also been heavily impacted. So I understand how stressful this must be for you all, especially those who are really close to graduation. So my heart is with you. I have heard from some students who go to schools where they've taken a little more of an innovative approach for helping students continue to progress in their nursing program. So there are some schools that are allowing for online simulations in lieu of clinical hours. Also, I have heard of some campuses allowing a handful of nursing students to come onto the campus at a time to take proctored exams while still maintaining social distancing. So if you go to a school where they are taking some of these innovative approaches, then definitely share that information here in the comments. And if you go to a school that is not doing these things, then I encourage you to read those comments and maybe bring forth some ideas that you read to your school's administration for how they can help you and your classmates continue in the program that you're in and not be delayed so much. Can't guarantee that it will work, but it is worth trying. Also, there is a petition circulating that will allow students to basically adjust their clinical hours in order to still graduate, basically reallocate them somehow. So if you're interested in signing that, then I encourage you to do so. For RNs, a lot of us are fairly concerned about PPE recommendations out there right now, which is the protective gear that we wear when we go into patients' rooms. And there is another petition from the ANA, American Nurses Association, regarding that. We just want to make sure that PPE requirements are based on science and not based on supply chain constraints, right? We don't want to go into a room with improper PPE just because there's a shortage of that PPE, because we don't want to infect ourselves and bring that virus home and infect our family as well. So like I said, that is a petition from the ANA. I just signed that earlier today. In terms of your plan, you're at home. I would really encourage you to use this time wisely to work ahead and really master the nursing material that you need to master. So we have free videos for you to use. We've got cards available on our website. I would also strongly encourage you to take as many practice exams as you can, because those are super helpful. And really just kind of plan out your time. Set some goals for what material you want to cover by when. And like I said, take those practice exams as well to really refine your knowledge. Be sure to read all the rationales and explanations as you're taking those exams. In terms of other ways that you can help in the community, right now there's a pretty big blood shortage. So I would encourage you to give blood if you're able, because right now there's a lot of people who are afraid to go out and do this. And so that has really resulted in a shortage. I would also encourage you, if you have some time for some community service, Meals on Wheels is really looking for some help. A lot of the people who drive around with the meals are like older adults who are kind of quarantined at home right now. So they are lacking in drivers. So if you're able to help out with that, that is great. If you have an elderly neighbor or an older adult neighbor, then you may want to give them a call and find out what they need from the grocery store. And when you go to the grocery store for your family, maybe you pick up groceries for them as well and, drop them on their doorstep so they don't have to go out and get exposed, because they're definitely at higher risk for more severe complications with the coronavirus. And then lastly, I really urge you to get educated on the coronavirus and the importance of social distancing and the importance of flattening the curve. So definitely get your information from reputable sources such as the CDC. A lot of stuff that you see on Facebook or Instagram is not accurate and not based on science. So definitely, as a nursing student or a nurse, people look to you as being more of an expert for health advice. So definitely take the time to get educated on that so that you can provide good information out there. There's a lot of younger people who are like, oh, I'm not going to die from the coronavirus, so I'm going to do whatever I want, right? But unfortunately, that really jeopardizes a lot of the more vulnerable people in our community. And so if you can do your part to help educate, that would be awesome. And just be careful about what you post online so you're not spreading misinformation. Also, future employers may look to your social media feed, and you don't want to do anything that's going to make you look bad in their eyes as well. So please take care of yourself, take care of your family. Use this time wisely as best you can. Sign some of those petitions that I mentioned and share your thoughts, your ideas, and what your particular school is doing or not doing here in the comments so we can all benefit from that information. So take care, and I'll see you soon.